Hello, Dr. Grande. My name is Dr. Sohom Das. I'm a consultant forensic psychiatrist and I live and work in London. I'm also the host of a YouTube channel called Psych for Sore Minds. Firstly, I just wanted to say that I'm a fan of your channel and I've subscribed. I like most of your videos. I don't always agree with the content, especially about the psychiatric breakdown, but that's fair enough. People are allowed to have different opinions. Something that's bothered me for a while is it's not very clear what your area of expertise are, especially because you call yourself Dr. Grande and your channel's called Dr. Grande. As far as I'm aware, you don't have any qualifications or specific expertise in psychological matters or psychiatry, yet you talk about personality factors, you talk about symptoms of mental illness, and you talk about specific diagnoses. I wasn't going to do anything about it, but I felt compelled to make this video after I saw your video, which you released recently on the 14th of December, called Is Jill Biden a Real Doctor? I thought it was a good video, definitely one of your better ones. I think it was good of you to call out Epstein for his sexism and being patronizing. Like you, I also feel compelled to call out bullshit when I see it. I also like your historical breakdown of the term doctor, thought it was detailed, thought it was accurate. In your video, you yourself talked about the etiquette and when it's appropriate and when it's misleading used to say that you're a doctor.
The exception is that a doctor should not use the title doctor when doing so would be confusing to the public or otherwise cause harm.
You even gave examples of when you've seen this in your own clinical practice.
There was a situation where a person had a PhD in art history and a master's degree in a field related to mental health therapy. She referred to herself as a doctor. Let's just call her Dr. Smith. That wasn't her name, but that's a common name, so I'll use it here as an example. In an environment where consumers would be expecting to encounter a mental health professional, an art history PhD, like Dr. Smith, using the title doctor creates an unethical and dangerous situation. A client might go to Dr. Smith and think that she has a doctorate in a mental health field, but that client is being tricked. They're not being exposed to the level of competency they believed was there. Because Dr. Smith had a master's degree in a mental health field, she was a mental health professional and she could call herself that. She just can't use the title doctor in that context.
And I can also relate to this. So I've seen this myself. When I was in third year at medical school, one of the other people on the placement was a woman who was a doctorate in psychology. And she would go up to patients on a ward and she would introduce herself as Dr. Smith, to use your pseudonym. And she would ask to examine the patient. And although she didn't directly say it, she heavily insinuated that she was a doctor that was there to examine the patient as part of their treatment, as opposed to a medical student who was doing it just for her own practice. And I remember feeling really uncomfortable at the time, and I wish that I said something, but the moment just passed and I didn't, and I regretted it back then and I regret it now. To be blunt, I'm just a bit worried that you might be doing something similar here. So there's no information on your YouTube channel about your qualifications or your expertise. I can see from looking at LinkedIn that you're a doctor of philosophy and that you're also a qualified mental health counsellor, but your videos are not about philosophy. And I don't know about in the States, but in the UK certainly, a counsellor cannot diagnose mental illness and they can't talk with any authority about personality traits. Their main role is to give kind of talking support and therapy. To be clear, I'm not for a second suggesting that you can't make YouTube videos and that you're not allowed your opinions. Of course you are. But I do think that it's misleading, perhaps unintentionally, to call yourself Dr. Grande and not make it clear exactly what you are a doctorate of. And I think by doing this, there's a risk that you might mislead people into assuming that you're a psychologist or a psychiatrist, like I did. That's why I assumed before I did some background research, especially given your own personal stance as you expressed in your video. So I make YouTube videos regularly, but I make my qualifications, my area of expertise, and my experience crystal clear. And if you see my videos, you'll also know that I express my limits. So if there's something that I don't feel qualified to talk about, I make that clear. There are a few other experts in my field that I follow who make YouTube videos. For example, Dr. 𝐏𝐬𝐲𝐜𝐡, The Psych Show with Dr. 𝐴𝐵 Mattu, Dr. Tracy Marks. All of these people express either in their YouTube channel or in their actual videos or both exactly what their qualifications are. And so I'm just inviting you to do the same. The reason I'm passionate about this is that in my career, I've seen dozens of times where patients have been misled or been given bad advice. So I'll give you an example. Just last month, I assessed a woman who had quite severe anxiety, and her therapist thought that it might be a side effect of her medication. So she told her to stop taking it. Actually, it wasn't a side effect. It was the breakthrough symptoms of anxiety. So the woman actually needed a higher dose of that medication. But she took the therapist's advice and she actually got much worse for several weeks and she really was suffering. When I spoke to her about it, she had assumed that this therapist was qualified to talk about medication, whereas therapists, psychologists are not qualified to prescribe medications, whereas psychiatrists, who are doctors first, are. So I'm not accusing you of giving bad advice. I'm just inviting you to practice what you preach and make clear your qualifications, especially given your own stance that you've expressed in your own video. Thanks very much for listening, and I hope to hear from you. Bye.